Yes, hello viewers, welcome to my channel. Thank you for clicking. So in today's video I'm talking about something very common, and those are fibroids. So I want us to see what are fibroids, how do they come about, you know, how do you know that you actually have fibroids, and what is the best way to handle this particular matter. So that's what I look at in today's video. So uh, my name is Catherine Asimwe. I'm a candidate of a bachelor's of medicine and surgery, and I live in Uganda. So to start with, fibroids are non-cancerous tumors of the uterus. So I mean, every female has a womb that helps us to carry the baby to term. So this womb sometimes is attacked by tumors, and in this case for the fibroids, they are not cancerous. Yes, no one should ever tell you that fibroids are cancer. No, they are not cancerous. That's why their other name in medical terms is leiomyomas. So these fibroids usually affect various parts of the uterus. Sometimes they affect the uterus, the body itself, you see, or sometimes they affect the lower part, which we call the cervix. And on the body, sometimes they grow outwards via the outer muscle, growing into the abdomen. Sometimes they remain confined within the muscle itself, which we call intramural fibroids. Then sometimes they grow into the cavity, what we call the submucosal fibroids. Then we have the cervical fibroids, the ones which grow down this way in the cervix. These fibroids they are kind of tumors that respond to estrogen. What do I mean? They grow. Their growth is stimulated by estrogen. So in states where we have long duration of estrogen exposure or high estrogen in the body, they stimulate some cells called smooth muscle cells in the uterus, which start multiplying, and that's how they form a fibroid. Are we together? So what are those things that prolong the period of exposure to estrogen? Things like you see, from the time we start our menses to the time we stop at menopause, during this period estrogen is reduced. So in case you have your menses earlier than normal, that is before 12 years, or if you have your menopause later than normal, that is above 52 years, usually in that case you have a longer period than, unlike other females. Yes, in that case where you have a longer period of exposure. So in that case, there are chances that fibroids may develop, because this estrogen will be available all the time, yes, for a longer period of time. However, the amazing thing is that usually after menopause, estrogen goes down. So if you suffer from these fibroids at the end towards menopause, there are chances that they will shrink on their own, and so they don't need attention. Yes, are we together? They don't need attention. If you get them like at 50, there are chances that they are going to shrink on their own, because very soon estrogen will be cut off and they will shrink on their own. So we don't need to worry about those ones. Then the other thing I need to talk about, which affects duration of exposure, is during pregnancy. Estrogen, we get estrogen holidays. So in cases where you've not had any child, or we've had one child, and then maybe intentionally or because maybe secondary infertility has come up, in such cases that's also, there is longer periods because there are no holidays from estrogen. So that's why it's high that there are higher chances that anyone that has not had any child, that's what we call the nulliparous, and if you've had one child, there are chances that you suffer fibroids. So you need to keep alert. Then if estrogen only contraceptives, usually the contraceptive you're taking is estrogen and progesterone. Don't take an estrogen only contraceptive, because these are the things that are going to do what? To increase estrogen in the body and increase chances of fibroids. Then the other thing I need to talk about that is important is, you see this body of ours, every time it sees fat anywhere, I mean fats, it goes there and converts them into estrogen. You get? That's why most people would emphasize that when you're fat, if you have a high body mass index, I mean that above 25, usually there are high chances that you will get cancers that are related to estrogen. For example, check out my breast cancer video. I talked about breast cancer being related to obesity. So same applies here. Fibroids, breast cancer, all these tumors are related to estrogen. So if you're base, you are at risk of these two. In that case, that's why we encourage weight reduction is key, not only for your personal comfort and for aesthetic purposes, or to also, however, we also want to prevent these cancers here and there. So moving forward, I want to know, how do you know that actually fibroids have set in, such that we get the remedy as early as possible. I need to emphasize this before I move forward. 75% of the fibroids won't give you any symptoms. Usually it's incidental that you will find them. And that's good news. However, a few of those may give us symptoms. For example, in most cases, you start by experiencing heavy menses. Ideally, we expect someone to have their menses for like 3 days, using at least three pads in a day. Hmm? But if you're experiencing longer days of menses and you're using like 6 pads in a day, with an abnormal flow, that's what we usually call in medical terms menorrhagia. If you're experiencing that, there are high chances that fibroids could be present. Then, in case you experience irregular bleeding, for example, we expect that you get a cycle, wait for about 20 months. So if you're that person that experiences those intermenstrual bleeding, like in the middle of the month, from nowhere you start, maybe for one day and then it stops like that, the chances that they are fibroids. You know what happens is they get ulcerated. In most cases, when they are just there, they get infected and get ulcerated. Usually it's them that are bleeding actually. It's not the normal endometrial shedding that occurs during menstruation. So in those cases, it points us to fibroids, though we need to confirm in the hospital. Then sometimes, depending on the size, you may feel heaviness. If it's big enough, you may feel heaviness in the abdomen, like someone who is pregnant, feel heaviness. So that could be fibroid. Then sometimes also size affects the nearby organs. Sometimes you may start getting constipation episodes because it's compressing on the rectum. Sometimes you start getting urine retention because it's compressing on maybe on the bladder. Sometimes even urine frequency, like urinate more frequently, because you cannot retain urine for long because the size has compressed on the bladder, it has become smaller. Sometimes also it can compress on the ureters. Now that is dangerous because urine starts flowing back to the kidneys and can give us hydronephrosis. That's why we need to take, if you realize that you're feeling a lump, like a big lump, you need to take note. Then the other thing that causes attention in most cases is if you're there and your pregnancy is like you carry a pregnancy to the second trimester and then from nowhere you lose it. When these fibroids grow inward, especially those which grow inwards, they distort the structure of the uterus. So as the baby is growing, it has nowhere to grow. The size is smaller, Sometimes even the implantation is wrong because where it was supposed to implant, there is a fibroid. So all these things, they affect pregnancy. So in most cases, if you get recurrent pregnancy losses, if you get preterm labor, you start getting labor before the pregnancy is term. You get. So you need to watch out for this, and yeah. So basically those are the ones. Sometimes also they cause infertility because implanting, if there are very many, implanting is impossible. Implanting, when the egg has come, when it has been fertilized, it has to attach itself somewhere on the uterus and starts growing and multiplying. So if fibroids are all over, it can hardly even implant. So that's how we get infertility in fibroids. So what is the best approach? What is the medical approach I would talk about? So like we saw, most of the fibroids may not show symptoms. You may not have all those symptoms. You just be there and you're fine. All these problems are not there. So those kinds of fibroids, we like to observe them just. Yes, provided we try to, there's what we call palpation in medical language. If we try to check them and they are less than 12 weeks, we know how to assess pregnancy. So if they give us a size of a pregnancy that is less than 12 weeks, yes, it's a fibroid, but if it's equivalent to a pregnancy of less than 12 weeks, that one we have to just observe it because it won't do anything to you, provided it has no symptom. However, you have to keep being followed up. At least every 6 months, you come around and you do the necessary scan. Some of these, atrophy, undergo various changes, atrophy, and you normalize. So such fibroids are not worth tampering with. Now I'll go to the ones which are symptomatic. I guess if you're viewing this video, maybe you have symptomatic fibroids. What is the best thing to do? So it's not that always it should be surgery for fibroids. No, it's not always surgery. So I need to inform you that usually we have medical management and then surgical. Of course, surgical is definitive where you're sure, though of course there are recurrences still. So here's the thing: we have medicines that are available, which one will stop the blood being lost. Fibroids keep bleeding. Then they will also reduce the size. They will shrink it. So those medicines are there, and we have various groups. There are very many. If I could list, we have the antiprogesterones like mifepristone. This will reduce also the size and also reduce blood loss. We have selective progesterone receptor modulators like uripristal, which also will reduce by the 10th day. Then we also have gonadotrophin releasing hormone analogs, agonists or antagonists. All these they will help shrink the fibroid and reduce blood loss. We have anti-gonadotrophins like danazole, reducing the size, reducing blood loss. So these are medical. Then also these are hormonal. Someone may be worried, these medicines may tamper with my hormones, and maybe the other day would want to conceive, and then I'm having challenges. They are also non-hormonal ways. We have tranexamic acid, usually give it to stop the blood loss. We have some medicines, they are aromatase inhibitors, like anastrozole, which can also help us without tampering with your hormones. So those are for, kindly note that medical management, we recommend it for if the fibroid is of the size of a pregnancy, that is less than 12 weeks, and then also for those who want to give birth, who have not yet finished their family size, and then also we can give it anticipating for surgery. We want to reduce the size such that it's easier to operate. Yes. So basically that is it. Moving to surgery, actually the surgical options we have, commonly there are two, depending on whether you still want to give more children or not. If you still want more children, we do a myomectomy where we shall open and then pick out those patular fibroids. Usually they are enclosed in capsules. We shall open the capsule, pick it out like that. Though it disturbs when they are multiple, because they have multiple adhesions and scars. So usually if it's like one, it's picked out. Then in cases where you're done with your family size, no need of more children, those are the cases where we do what? We resort to doing the hysterectomy, which is removing the entire uterus. Yeah. There you're sure of never suffering from them again. And myomectomy, they may reappear. Medical management, they shrink. Then for those that have occurred towards menopause, they will regress, because after menopause, estrogen lowers. So they just regress on their own, and no need to worry about those partial ones. So that is the best approach to fibroids. Yes, I don't know. If in case you have any questions, kindly type them in the chat. I will be able to answer. Yeah, let's interact. What you know about fibroids, what you've heard, and yeah, let's live a healthy lifestyle together. Thank you so much. Kindly subscribe. Don't forget and like the video. Share with your friends. And yeah.